Case 3. The Ill Returning Traveler. History. A 46-year-old man has presented to the emergency department complaining of fevers, vomiting, and general malaise. He describes experiencing fevers and rigors every 8-12 hours for the past 3 days. He feels weak and tired and has vomited several times. He has recently returned from a holiday in Ghana where he took part in a camping trip. He was previously fit and well with no medical problems and no regular medications. Examination. This man is febrile, 39.7 C, and tachycardic, 100 miasmin. He looks pale and his mucous membranes are dry. His abdomen is soft but tender at the left upper quadrant, where splenomegaly of approximately 8 cm is palpable. He has multiple skin lesions around his ankles, which he attributes to mosquito bites. Questions. Considering the possible diagnosis, what investigations should you request? How should this man be treated?
The patient describes swinging pyrexias and has moderate splenomegaly. He has recently returned from Ghana and has many mosquito bites on his extremities. It would be useful to ask the patient whether he was taking anti-malarial prophylaxis. The clinical features fit a diagnosis of malaria, and appropriate tests should be requested to look for this. A full blood count may show anemia predominantly due to red blood cells being destroyed by malaria parasites, and a thrombocytopenia. Renal and liver functions may also be deranged. A blood film will confirm the presence of malaria parasites. Identify species of parasite and measure parasite levels. The treatment will depend on which type of malaria the patient has, Plasmodium falciparum. With a high parasite count, will need treatment with intravenous quinine followed by oral doses. 5% dextrose may need to be given, as blood glucose levels can fall in these patients. Other types of malaria, such as Plasmodium malaria, PVVAX and P. ovale, are more benign and can usually be managed with a short course of oral antimalarial. Key points. Malaria should be suspected in patients with an appropriate travel history who present with fevers and rigors. In patients with suspected malaria, blood should be sent for thick and thin blood films, looking for the presence of the parasites. Once a parasite has been identified, treatment advice can be sought from an infectious diseases specialist to guide further management.